100.3 KRRV. I'm going to use his voice.
His voice.
Jeff Bates.
Let me see if I can get mine that low.
Go ahead, buddy.
Hello.
You got them
Hello,
long,
darling.
slow kisses. Hello.
I love that song.
He did do a heck of an imitation of Conway
Yeah,
on a
what?
cruise ship at one time. 8:06 in the big city. Our friend Dr. Guillory from Red River Sinus Center is here. Give it up, show you love. Doc,
Yay!
how you doing, friend?
Doing great. How y'all doing this morning?
Wonderful. We have been talking about and talking with doctors that have gotten together and now opened the Red River Sinus Center here in Central Louisiana.
That's it. That's us. We've been doing it for this new procedure, balloon sinuplasty, for just about a year at Red River Sinus Center. My partners, Dr. Rennick Webb and Dr. Christian Wold, and myself, Paul Guillory, all three of us are performing it. It's we're very happy to be performing it, and it's a great service that we can provide to our patients. It's a real common problem. Sinusitis is one of the most common health problems in the United States, affecting over 37 million people a year. Visits for sinusitis to physician's office exceed 20 million a year, and the cost for that treatment exceeds $8 billion a year. So it's a very prevalent, very huge problem, and so we see a lot of it. Patients with chronic sinusitis, typically they present complaining of midfacial fullness and pressure, nasal congestion, drainage. It may be clear, maybe yellow, maybe greenish. A lot of headaches in the forehead, headaches on top of their heads. And it's a reoccurring problem, or a chronic problem never goes away. For many, a reoccurring problem. They get these symptoms. They're seen by their doctor. They're treated with antibiotics. They're treated with antihistamines, nasal steroids, nasal antihistamines, other allergy medicines. And they get some relief, but the symptoms reoccur and they come back. And for those patients, oftentimes they're labeled as chronic sinusitis and referred to us. Prior to a year ago, many of those patients would end up having a moderately invasive or quite invasive procedure called endoscopic sinus surgery. That was a procedure performed in the OR under general anesthesia. So the patients will sleep, they lose that entire day, and anywhere from 3 days to a week off of work with it, because it's a pretty invasive procedure. But now we're very happy to be offering a minimally invasive procedure called balloon sinuplasty, done on an outpatient. Patients walk in the office, they walk out. For my patients, I do it under topical anesthesia. No injections, no needles. I'm able to anesthetize the interior of the nose using a concentrated numbing gel. So the patients come in and I pack their nose with this concentrated numbing gel, and I get dense anesthesia of the inside of the nose. Then using a lighted balloon catheter, I'm able to dilate the natural drainage passage of the sinuses. We say sinuses, those are air cavities in the face, under, between, and above the eyes and behind the eyes. So the whole procedure takes about an hour, minimal discomfort, again, for my patients under topical anesthesia. And they go home, and typically they go back to work the next day. And patients report relief of this midfacial fullness and pressure that they had for years and years. And are very pleased with the results. So we're, all three of us, Dr. Webb, Dr. Wold, and myself, are performing these procedures just about daily in the office now.
Well, I was going to say that my little granddaughter, Dr. Woe, took care of her. From birth, she was always having problems, and she recently had the surgery, and it's helped her thus far. She made a move. My son went into the Army, and they went to Arizona, and she hadn't been in school, and she, like I said, been sick from birth, and he did this procedure, and it's helped her not to get so sick all the time, So it was amazing, and it was, like you said, we were in and out, and she was immediately, being able to breathe better, feeling better, and she's only 4, so apparently any age. So how do you know when you need a procedure like this?
The typical patient, as I said, they present with reoccurring complaints, midfacial fullness and pressure, nasal congestion, nasal drainage, have had multiple visits to their doctor, and it just keeps coming back.
Mm-hmm. Is that our old school sinus infection? You need a Z-Pack, or you need some Vic Salve up in there. Is that the
typically,
old school?
That's not old school. That's the first line. First, most or many sinus infections will resolve without treatment if you wait long enough. Many will not. And typically patients, when they do initially present to us, we're kind of a tertiary center. We see the patients who have been seeing their family doctor for years, and they come to us because they've been treated multiple times. But somebody with an acute sinus infection coming in complaining of drainage, congestion, pressure, headaches, treated with an antibiotic, a nasal decongestant, sometimes a nasal steroid. In those patients, when it resolves, it doesn't come back, or they get it once a year, that's the treatment. They don't need surgery. But today, what for balloon sinuplasty, we're talking about patients who have reoccurring symptoms, or there are people that live with this dull, aching midfacial fullness and pressure daily.
And you don't have to.
No, exactly. And many of those patients, we evaluate them. Typically, we'll do a CAT scan, a CT of the sinuses, which is done in our office the same day that they come in. And if that exam shows narrowing of the outflow passage of the sinuses, oftentimes they're a candidate. Most insurance companies in our area cover the procedure, as well as Medicare, and many of the Medicaid insurers cover it also.
Was this a breakthrough in medical technology just out of the blue, or has this been coming on for years, just needing a way to do it?
Been under development for about 5 years.
Right.
Actually, it started initially by a cardiologist who was supposed to have his sinuses open. They offered the endoscopic sinus surgery. He said, just balloon it. And they said,
like a stent in the heart.
And that's where this came from, balloon angioplasty, where the cardiologist would insert a catheter into a coronary artery and blow a balloon up and dilate it, expanding that vessel, then pull the balloon out. This is very similar with a light-guided catheter. With a balloon on it, we're able to cannulate, insert the catheter into the drainage passage. We insert a balloon over it, dilate the balloon, and you'll hear some cracking and popping, and actually physically opens that passage. Then we deflate the balloon and the catheter and pull it out, and it stays open. Studies are showing it's staying open for at least 2 years, and it's a new procedure, so studies are showing it 2 years now, but we suspect it'll be beyond that period.
How wonderful that has to feel, because it's just it'd be like a matter of that first time you used that nasal spray where it worked like a charm.
Exactly.
And most patients report within a week relief of the pressure, and almost all of them say they can breathe better.
Sleeping, working, running, exercising.
Sleeping better, working better. And for some people with obstructive apnea, it can lessen the severity of obstructive apnea. I'm not saying cure it, but it can lessen severity and make it more tolerable for them to tolerate their CPAP if they're on that, allowing them to breathe better. You mentioned your granddaughter, 4 years old.
4 years old, yeah.
We're doing these in the office on adults, but also it's indicated for children with chronic nasal drainage. For a young child, of course, we're not able to do it in the office, but we do the same procedure in the operating room under general anesthesia. Yeah. We use a smaller device, but again, it's a light-guided balloon catheter that we dilate the natural drainage passage. And this physiologically just makes sense that with the older procedure, we were drilling out a new passage or dilating the old passage. With this procedure, we dilate the existing passage without tearing it and minimizing scarring and getting great results with it.
Oh yeah, it's amazing
now,
how much it helped her.
When is she going back to work? She's
only 4, but I wanted everybody to know.
Oh yeah, it makes sense. Yeah,
poor little baby, she was just always.
Oh, absolutely. And y'all had many doctors and many procedures y'all had already tried.
She had been to the doctor and everywhere and everything, and it just all the sicknesses she had, it led to this. And I just wanted people to know that if you have a small child or no matter what age you are, this is something that you definitely want to look into. There's no reason to suffer with all that pain.
Dr. Guillory, do we need referrals? Do we need to? I mean, if we just think we have this problem that we've been having for years and years and years, it's just something we call and get an appointment.
That's it. Red River Sinus Center, 321-5500, and we will set up the appointment. You do not. Depending on the insurance, most insurance companies do not require a referral by your family doctor. So yes, we take self referrals, and we're. We're here in Central Louisiana, located right off of Windermere Boulevard, across from the Eye Center and across from Rabelais Small Engines. So we're here and very excited about this procedure, excited to offer it to our patients in Central Louisiana.
Well, I tell you how wonderful it is, because my little granddaughter, being 4 years old, when one of the first things that whenever they were getting ready to move away, she says she wanted to know if Dr. Woe was going to come with her. So that's how much, even after doing a procedure, like that, she knew how much she helped him. So I mean, it's amazing.
Is he still hanging around? He just comes around every once in a while.
What, Dr. Woe? Probably when she comes in town to visit, she's probably going to do that.
Okay, and Doc, where are y'all located at exactly?
Right off of 28 West on Windermere Boulevard.
It's kind of a medical complex going on.
It's medical,
back there.
Correct. We're Red River Sinus Center. We feel we've developed this as a center of excellence in our other centers. We're Red River Ear, Nose, and Throat Associates, and also Red River Sleep Center. So it's a continuation of centers of excellence that we're offering our patients, and excited to do it.
Okay, we just need to give you a call. That's all.
Give
we
us
need
a
to
call.
do. Give me that number one more time.
321-5500, 321-5500.
Very easily done. Thank you so much. Wow,
Yeah.
and this is in Central Louisiana.
Yep. Don't
People
even have to go out of
around the
town.
state and
Yeah.
other states are coming this way
Yeah.
to get this done. It sounds like it's a miracle
It's
thing.
it's
that's
amazing.
come
I can tell
along.
you for a fact.
Why didn't I come up with this? I got to start.
Thank you
You're
for
not
having
a
us.
doctor.
Thank you, Dr. Guillory.
Thank you for coming in.
Appreciate it.
I had a half a semester of pre-med. I think that counts.
I don't want to hear it.
I think that counts.
It does not count.
8:16 in the big city, 16 minutes after 8 o'clock. We'll be right back.